Good day, ma'am. I am Jericho A. Bernes, and I will be your student nurse for today. But before anything else, ma'am, can I ask basic information about you?
Yes, sir.
Okay, what is your full name, ma'am?
Lisa May Basina, sir.
And how about your age po, ma'am?
19, sir.
Okay. And so, in collecting the basic information of the patient, it will help us to ensure that we are assessing the right patient in front of us. So, for today, ma'am, we're going to assess your hair, nail, skin, mouth, eyes, and the nails. And this assessment, ma'am, will provide data or information necessary to treat the condition of your skin, nail, hair, mouth, and eyes. But before we are going to proceed to the assessment, ma'am, first I will going to perform proper hand hygiene. And then I will going to apply clean gloves to prevent the transmission of microorganism po, ma'am. If there are any curtains or door in the room, we have to close them as well in order to provide privacy. So ma'am, isasara ko lang po yung mga curtains po for your privacy po. Okay ma'am? Okay lang po ba na malaman ko po yung mga past history niyo po?
Okay lang po.
Okay. Is there are any skin problems, ma'am, like rashes, skin lesions po,
Wala po.
dryness of the skin po?
Wala din.
How about loss of hair po?
Wala po.
Have you had any recent trauma to your nails po, ma'am?
Wala po.
Do you have any medical problems such as peripheral vascular disease or diabetes po, ma'am?
None, sir.
Current use of eyes medication po, gaya po ng contact lenses po, gumagamit po ba
None,
kayo?
sir.
Okay. Current symptoms of eye problem po, gaya po ng blurring of vision po,
None, sir.
pananakit po ng mata po, ma'am.
None, sir.
Okay. Do you have any problems with your teeth or mouth, ma'am?
Wala po.
Sa gums niyo po, namamaga po ba, ma'am?
Hindi din po.
Okay. And now, let's proceed to the first part of our assessment, which is the inspection of skin color. So, in this procedure, it may help us to identify if there are any abnormalities or skin oncyanosis. So, ma'am, patitas po yung kamay, ma'am, like this po. I observe, ma'am, that your skin doesn't have any abnormalities po or skin oncyanosis. So, next naman po na gagawin natin, ma'am, i-inspect lang po natin kung meron po kayong mga bruises po, scratches po, or any signs of wounds po. So, pakitas ulit yung kamay, ma'am.
Amoy na.
Okay, ma'am, I observe, ma'am, that your skin doesn't have any skin lesions po or any signs of wounds po. So, that's good po, ma'am. And after we inspect the skin for any coloration or discoloration or skin lesion, and we will now proceed to the second part of our assessment, which is the palpation. So, the first thing that we want to palpate is for the skin edema. In doing that, we're just gonna press firmly with our fingers for 5 seconds over a bony area such as the tibia. Okay, ma'am, during our palpation, ma'am, there's no any presence of edema po. So, ma'am, next na gagawin natin po, ma'am, we're gonna palpate for the skin temperature, ma'am, and moisture po. So, pakitas po ulit yung kamay, ma'am. Okay, ma'am, your skin po, it is smooth and warm. That means po, it is normal po. And next naman po na gagawin natin, ma'am, we're going to palpate your skin temperature po by doing that po ma'am, we're gonna use my back hands po. Okay lang po ba ma'am? Nakahawakan ko po yung face
Okay
niyo
lang.
po. Okay po. Okay ma'am, during our palpation po, your skin temperature po ma'am, it is warm. That means po, there's no any indication of sickness po. Okay ma'am, last po na gagawin natin ma'am, we're going to palpate for the skin mobility and skin trigger. And if the skin returns immediately to its original position ma'am, that means that there is an absence of skin trigger po. So pakitas po ulit yung kamay ma'am. Okay, ma'am. I observe, ma'am, na wala naman pong nag-indicate na meron po kayong skin trigger po. That's good po. So, ma'am, we will now assess your hair. But before that, ma'am, do you have any question po or clarification?
Wala po.
Okay po, ma'am. So, in assessing the hair, we want to inspect the evenness of growth over the skin, hair thickness and thinness, as well as the hair texture and oiliness, and inspect also the amount of body hair. And then note presence of infection by parting the hair several areas, checking behind the ears and along the hairline at the neck. Okay, ma'am. Okay lang po ba na i-touch ko po yung hair niyo po para malaman ko po kung meron po bang mga dandruffs po? Ganun po. Okay, ma'am.
Nakalakal na ba?
Hindi.
Okay, sorry, sir.
Okay, ma'am. Your hair and the scalp po are clean and the hair also it is smooth po. Okay, ma'am. We're done on assessing the hair and now we're going to assess your nail. And so, in assessing the nail, what we are trying to see here is to inspect for the texture, shape, and color of the nail and see if there are any presence of clubbing of the nails. So, can I see your fingernails po, ma'am? Okay, ma'am. I observe po na yung nail nyo po is malinis po. Then yung shape nyo din po is pa-convex po. That's normal po. So, next naman po na gagawin natin, ma'am, i-assess lang po natin for the capillary refill po. So, in doing that, we're just gonna briefly press the tip of the nail with firm, steady pressure, then release and make sure that the nail color will quickly return to normal. Based on pinching, ma'am, your nails, bumalik naman po siya sa dati niyang kulay po. That's normal po. So, ma'am, we're done on assessing your nail po, ma'am. And now, let's proceed to the next assessment po, which is the eye assessment po. So, first is we're going to inspect the eyebrows for hair distribution po and alignment and as well as the skin quality and movement po. Okay, ma'am, may I ask you to raise and lower your eyebrow po. Okay, your eyebrow is symmetrical and the hair distribution is normal as well. And next naman po, we're going to inspect the eyelashes po for evenness of distribution and direction of curve po. Okay, yung eyelashes niya po, ma'am, is nakasymmetrical naman po siya. That's good po. And next naman po, ma'am, inspect lang po natin yung eyelids po. So, in proper visual examination of the eyelids, we're just gonna elevate the eyebrows with our thumb or index fingers. Okay, ma'am. Wala naman po problema sa inyong eyelids po. Okay naman po siya, ma'am. And then next naman po na inspect natin, ma'am, is yung bulbular conjunctiva and palpebral conjunctiva. So first na i-assess natin po, ma'am, is for the bulbular conjunctiva that lying over the sclera. In doing that, we're just gonna retract the eyelids with our thumb or index finger, exerting pressure over the upper and lower bony orbits. Okay, ma'am, can you please look up po? Okay naman po yung color ng inyong bulbular conjunctiva po, and wala din po siyang mga lesions po. And then next naman po, na-inspect natin yung palpebral conjunctiva that lining the eyelids by everting the eyelids po. Okay, ma'am, I will use the cotton tip applicator po, ma'am, and can you please look up, ma'am? Okay, your lids po, ma'am, there's no swelling and no infection din po. That's good po. Then next, we're going to palpate for your lacrimal gland, lacrimal sac, and as well as the nasolacrimal duct po. So in palpating the lacrimal gland, we're just gonna use the tip of our index finger. Okay, ma'am, I observed that your edema, it is normal po. For the lacrimal sac and nasolacrimal duct, in doing that, we're just gonna use our index finger and then palpate inside the lower orbital rim near the inner canthus. Okay, ma'am, there are no obstruction in both eye and that is normal po. Then next thing that we want to assess, ma'am, is inspecting your cornea po. Okay, ma'am, tingin lang po kayo ng diretso po. Your cornea is clear, it doesn't have any irregularities as well, which is normal po. Then next po, ma'am, we're going to perform the corneal sensitivity to determine the function of the fifth cranial nerve po. And now I will inspect your anterior chamber for transparency and depth. So we're just gonna use the same angle to test the cornea and observe color, shape, and size. Ma'am, tingin lang po kayo ng diretso sa akin po, ma'am, ha? I inspect that the color of your pupil, ma'am, it is black and it's round and the size is 4 mm, which is normal po. And now let's proceed on assessing the pupil's consensual reaction to light to determine the function of the third and fourth cranial nerves. So, ma'am, I will going to darken the room. Is that okay for you, ma'am?
Okay po.
Okay. So ma'am, tingin lang po kayo ulit sa akin ng diretso po para maobserbaran po natin ng maayos po. So when I shine a light onto the right eye, the right pupil reaction is direct and the left eye is consensual. Then next, I will going to repeat the test eye on the opposite eye, which is the left eye. And so when I shine a light onto the left eye, the left pupil reaction is direct as well as the right eye consensual. So both eye have a papillary response, which is constriction. Then now I will going to assess for the pupils accommodations. So in doing that, we're just alternate the gaze from the near to the far object. Okay, so the visualization of the distance object, the client's pupil response is the lesion, and the visualization of the near object, which is my index finger, is her papillary response is constriction, which is normal. So, gagawin natin, ma'am, we're going to test for the peripheral vision. So, ang gagawin nyo lang po, ma'am, i-cover nyo po yung eyes nyo po with a card po, ma'am. And then, tingin lang po kayo ng diretso sa akin, ma'am. So, ito po pala yung card po, ma'am. Papangtakip nyo po sa inyong mata po. So, tingin lang po kayo dito sa akin kami, ma'am. Kapag nakita nyo po, ma'am, sabihin nyo pong stop po, ma'am, ha? Okay, let's start po, ma'am, ha?
Stop. Stop. Stop.
Okay, ma'am. As I assess your peripheral vision, ma'am, there is no deficits in the visual fields po. And now naman po, ma'am, we are going to test your distance vision using the Snellen E-chart. Okay, ma'am, upo lang po kayo dyan because you have to read the letters for just 60 cm po. Okay, ma'am, nag-provide po pala ako dito ng Snellen E-chart in order para po basahin niyo po, ma'am. So, pakitakpan po yung right eye niyo po, ma'am, and start to read this po.
E F P T O Z L P E D P E C F D E D F C Z P F E L O P Z D D E F P O T E C L E F O D P C T.
Yung next naman po, takpan niyo po.
E F P T O Z L P E D P E C F D E D F C Z P F E L O P Z D D E F P O T E C L E F O D P C T.
So, both eyes naman po na basahin niyo po ito, ma'am.
E F P T O Z L P E D P E C F D E D F C Z P F E L O P Z D D E F P O T E C L E F O D F C T.
Okay, ma'am, your peripheral vision po, ma'am, wala pong problema, ma'am. So, after assessing the eyes po, ma'am, and now let's proceed to the assessment of mouth and oropharynx. But before that, ma'am, can you please sit properly po? Okay, so the first thing that we want to assess, ma'am, is to inspect the outer lips po. Okay, ma'am, may I ask you to purse your lips po? Okay, ma'am, your outer lips po, ma'am, is pink, smooth, and moist, and symmetry of contour as well po. Okay, then next naman po, nagagawin natin, ma'am, we're going to inspect and palpate the inner lips and buccal mucosa po. So, open your mouth po, ma'am. Okay, ma'am. Your lips po, ma'am, is pink, smooth texture, and there's no lesions and swelling as well. And next naman po, I will going to inspect your teeth and gums. Okay, ma'am. Open your mouth po ulit. Okay din po yung color ng gums nyo po. Color pink po siya and wala din pong mga lesions po. And yung teeth nyo po, ma'am, it is white and complete and also there's no dental caries. Next naman po na i-assist natin, ma'am, is yung tongue nyo po. So first na inspect natin, ma'am, is yung surface ng tongue nyo po. Okay, ma'am, the tongue is in the central position po. It is pink and slightly rough po with no lesions po. Then, next naman po, I will inspect the tongue movement po. Okay. Can I ask to roll your tongue po upward, ma'am? Move it from side to side, ma'am. Okay, so your tongue, ma'am, moves freely and no tenderness po. Next, I will inspect the base of the tongue, the mouth, floor, and the frenulum. So, ask the client to place the tip of the tongue against the roof of the mouth. open your mouth po, ma'am. Then next is to palpate the tongue and floor of the mouth and any nodules, lumps, or excoriated areas. In palpating the tongue, we're going to use a piece of gauge to grasp its tips with the index finger of our hand, and then palpate the back of the tongue, its border, and its base. So her tongue has no tenderness upon palpating, and there are no masses as I palpate the tongue, which is normal po, ma'am. Then next naman po, we're going to inspect for the salivary duct openings for any swellings or redness po. Okay, ma'am, open your mouth po. Okay, ma'am. Then next, I will going to inspect the oropharynx, hard and soft palate, tonsils, and uvula. So, ask the client to open the mouth wide and tilt the head backward, then depress tongue with tongue depressor as necessary, and use a pen light for appropriate visualization. So, first na i-assess po natin, ma'am, is to inspect the uvula po while examining your palate po. Say po, ma'am. And next naman po is to inspect your oropharynx and your tonsil po. So in oropharynx po, we're just gonna depress your side of your tongue at a time about halfway back on your tongue. So I will gonna use the tongue depressor and pen light po for illustration po. So, then next I will going to inspect your tonsil po behind the fauces po for colored discharge and size po. So, I inspect po na yung palate nyo po is color pink and smooth din po siya. Yung uvula po is rises symmetrically po. And yung tonsils nyo naman po, color pink din po siya. And wala din po siyang mga lesions or exudate, and normal din po yung size niya. Then lastly is to test the gag reflex by touching the back of the soft palate with a tongue depressor and pen light. Open your mouth po, ma'am. Okay, ma'am, positive gag reflex is present po, which is normal po, ma'am. So that's all for our assessment, ma'am, and I will just document and record it po. So upon checking your assessment, ma'am, there's no any presence of abnormalities to your skin, nail, hair, eyes, and mouth. And thanks cute for your cooperation, ma'am. That's all. And I am Jericho Aviernes, and I am your student nurse from Isabela State University of Ilagan Campus.